The first case of COVID-19 was recorded in Uganda in March. 6 months later, Uganda has so far registered 6,879 cases and 69 deaths. Now, as parents wait for the schools to open for the candidate classes and finalists in tertiary institutions, the Ministry of Health is proposing that teachers need to be tested for COVID-19.
I only made a proposal that with the availability of these antigen tests, we could test some of the teachers because it gives you a quick answer as to whether somebody is infected or not. That is a proposal that will be discussed by the National Task Force.
Although the Ministry of Education is still tight-lipped on this proposal, some legislators had this to say.
Who is going to meet the cost? That's the question. The idea wouldn't be bad, but who is meeting the cost? Is it on the teachers? The answer is no. Once it is teachers, we shall battle it out and refuse it. But if it's the government, do it. However, when are you starting it? Secondly, after testing, what guarantee do you have that this person will not get the COVID again? Those are all the questions. Then, but before you test the teachers, are you testing all the children as well?
As the number of COVID-19 cases continues to rise, the designated hospitals for treating patients are getting overwhelmed. The ministry is now considering different options for easing the pressure. NTV has learned that there are several scores of patients who are once suffering from COVID-19 and were picked by the Ministry of Health and treated for the same disease, but have since been discharged by their families or their contacts have never been traced. And according to Aceng, the ministry is overwhelmed.
The families are too many and the people are too many. And so it is the responsibility of individual families to reach out to us. Kampala is widespread. The traffic jam is just impossible. And with a few health workers, how do you expect them to go into this widespread community at any one time? So the families themselves need to give information.
In a bid to cushion the hospitals which are overstretched, the ministry is considering home care, isolation and treatment for COVID-19 patients. This means that those who prefer to receive treatment at home can do so. However, self-isolation can be difficult or virtually impossible in instances where several people live in small places.
The National Task Force will sit today and discuss further management of COVID patients. And should we decide on home treatment, we shall give you clear guidelines on how it will happen.
For the COVID-19 patients, receiving treatment from the government hospitals may soon not be an option, and the ministry advises the public to remain vigilant and adhere to the standard operating procedures in the prevention of the deadly virus. Sudil Biarhanga, NTV.